we talked earlier about how the administration, or we played their claim that they want to follow the science. We hear that all the time. Follow the science. We follow the science. Follow the science. We follow the science. But do they really follow the science? I mean, we're finding more and more that they didn't follow the science when it came to COVID, at least not the medical science, maybe the political science. Well, the FDA rule change to allow pharmacies to distribute these pills is just one avenue that they're pursuing. Just yesterday, the Department of Justice declared that the U.S. Postal Service can continue to deliver chemical abortion pills by mail. So there's a many prongs going out here. And this is, of course, by ignoring the documented harms these drugs can cause for women. The Biden administration is putting its political agenda ahead of the health of women. Join me now to discuss this, Dr. Ingrid Skop, Senior Fellow and Director of Medical Affairs for Charlotte Lozier Institute. Dr. Skop, welcome back to Washington Watch. Good to see you.
Thank you for having me, Tony.
And by the way, Happy New Year.
Oh, thank you. It's going to be a good one.
I think it is. It is. Every year is good. Some are better than others. The Biden administration pushing harmful drug treatments at the expense of women. Can you explain to the viewers and listeners the dangers of these abortion pills?
Sure. As Chris said, the FDA has just progressively taken away any supervision on chemical abortions. And even when it was well supervised, even when women had to get it in person from a physician, we know that approximately 1 out of 20 of those women would fail and need surgery, often in emergent situations. We know that the complications are 4 times as frequent with a chemical abortion as they are with a surgical abortion. As a practicing OB-GYN in Texas for 30 years, I've cared for many women who've come into the emergency room frightened and in distress because of these pills, and they weren't expecting that. Since the supervision has been removed, though, it's getting even worse. It's being basically taken out of the doctor's hands, and these abortions are in the women's hands. They are self-managing their own abortions, which the industry used to tell us was a bad thing, but now they tell us it's just fine. When they get the abortion pills without an examination from a doctor, without an ultrasound, without laboratory evaluation, and even without looking the doctor in the eye so that the doctor can be sure this woman wants the abortion, it's not someone else who's pressuring her. All of those things have gone. So what we have now is women who estimate their gestational age, and maybe they're wrong. And if they're further along than they think, then it's highly likely that all the tissue cannot be expressed, and they're more likely to need a surgery or have an emergency. We can't tell who has an ectopic pregnancy, a pregnancy in the fallopian tube. When those women start to have pain and bleeding, signals that their tube is rupturing, they are more likely actually to die if they're undergoing an abortion because they may think this is the abortion pill working. We're no longer caring about Rh negativity. We're no longer offering women ROGAM when it's outside of the supervision of the medical system. And so in a few years, we're going to see women in subsequent pregnancies forming immune responses to their own children. And of course, we just have no way of knowing how much coercion is going to occur when sex traffickers, incestuous abusers, coercive boyfriends can all get a hold of these pills. As you mentioned earlier, distributing through the pharmacy is going to add a whole another level of violation of conscience of Hippocratic pharmacists. And of course, the ultimate goal would be to get it over the counter. But in the meantime, there also is a secondary goal to get doctors who are not abortion providers. Only approximately 10% of OBGYNs will perform an abortion. But now there's also a push to get doctors like me to be forced to prescribe these medications.
Yeah, let me be, I want to be clear on this, Dr. Skop. According to these rules, if I understand it right, as I've read this, that this drug can be prescribed with no personal interaction. That you do not have to. That is
the case.
You do not have to.
The FDA has removed all. Again, they used the COVID pandemic as an excuse for so much malfeasance. And in this case, they said it's too dangerous for a healthy woman to walk into a clinic. And so they've taken away that face-to-face interaction with a clinician, and that is permanently gone.
So I want to underscore what you're talking about. When we look at the problem of sex trafficking in this country and what is happening, that this would be very easy to, have that telephonic conversation or whatever the interaction is there. Does the woman have to pick up the prescription, or can someone pick it up for them?
It's not clear what the story on the other end at the pharmacy level is, but from what I've read with the new labeling, I do not think that there is any requirement that it be that patient. So, of course, we can recognize that this is going to be extremely problematic.
Now, these health implications, you've actually tracked this, and the reporting on this has not been good, and so getting the data is very difficult. But again, as I read the rule, there's a requirement that the provider be able to provide emergency health care if something occurs. As you said, the bleeding or some issue. So how's that work when they're not interacting with any healthcare provider? How do they do the follow-up and provide emergency care?
That requirement, Tony, is on paper only. The reality is these women are not, they're sort of edged into the chemical abortion, thinking that it's a very natural, safe process. They are very surprised when they have these frequent complications. And they end up in the emergency room system, being cared for by private gynecologists. Part of the perversion of the peer-reviewed literature that has allowed the FDA to make these changes is that the abortion industry publishes studies that are very poor quality, and they know that the loss to follow-up rates are 15-20% uniformly. And they just go ahead and assume that if a woman doesn't return to the clinic, that she had an uneventful abortion. And as the person who sees them in the emergency room, I would argue those are the ones most likely to have had complications. They don't want to go back to that abortion provider who misled them and made them think that they could not have a complication. It's very difficult to report abortion complications, but a recent analysis of FDA FOIA obtained documents demonstrated that less than 5% of the reported complications had been reported to the FDA. And this is back prior to 2016, when they actually used to care and used to mandate complication reporting.
Let me make sure I heard you right. Only less than 5% of the complications have been reported.
That's what we believe based on what we know to be the complication rate and what we've seen the FDA give to in response.
So how could we're out of time here, Dr. Skop, but how could the administration make a science-based decision when they don't even have the information?
The science is lost. I think we've seen that in the wake of COVID, and the same thing regarding abortion. You cannot trust what you read in the peer-reviewed literature. It's been totally politicized.
You're absolutely right. Dr. Ingrid Skop, thank you so much for joining us today. Always appreciate your insight into these important matters.
Thank you so much, Tony.